Good afternoon, everyone. Welcome. Thank you for coming. There still might be some people filtering in, but please continue eating. And I'd just like to welcome everyone here. My name is Andy Evans. I'm director of the Tufts Cancer Center here in Boston, and I think we have a good view of Boston today, don't we? So we're so happy to be here, and this was, as you probably know, thrown together somewhat at the last minute, but the good news is we can blame the Vice President. Because he literally just announced this 5 weeks ago, that they're having the national summit that started this morning at Howard University at 9 a.m., and he really put a call out 5 weeks ago to have local communities to hold local summits. And there's a couple hundred that are ongoing today. So we're thrilled to be one of them. I really want to thank everyone for taking the time out of their busy days to come today. And as we've tried to talk about, that we really are hoping and expect this not to be didactic at all. I have an initial couple slides that I'll run through just to level set, but really after that, our hope of this, and at least when we had a conference call with the White House last week, they expect every local summit to generate a report. In other words, an executive summary of our not just discussion, but really solutions on how to move the ball forward in terms of cancer care. So when we talk about cancer, and this is the only didactic part for a couple minutes, we know it's complex, it's heterogeneous, and to say we're going to cure cancer, that means a billion different things. And I think we want to just make progress. And the good news is, as you probably know the data, the last 25 years have been incredible. That over this past quarter of a century, that mortality rates in the United States have decreased by 25%, which is remarkable when you think about that data. So that's the good news. The other side of the coin is it still remains, despite this progress, the second leading cause of death in the United States. This year, it's expected to kill approximately 600,000 Americans. What does that equal? It's about 1,600 people every day dying of cancer. So I think that's our benchmark, is to make that less, make that lower. And that doesn't obviously speak to the suffering. That's just mortality rates. And what has the Vice President said? And really I think the thrust of this is great progress. Let's keep it going and double time it. Do it more. Put the foot on the accelerator. And we were fortunate to be at his residence at the Naval Observatory last December, and really to see the passion. I sat there 3 hours in a group led by Patrick Soon-Shiong, and it was incredible to see his passion, determination, and so this is the goal, is double the rate of progress in prevention, diagnosis, and treatment over these next 5 years. And I think, at least our take on it, I think many people's take, is that, as I'll show you in a second, they've identified some knowledge gaps, but I think they've rightfully said, we don't have the answers. And it's going to take literally a collective effort. And what do we mean by collective effort? It's new alliances and to accelerate all of the above. And so when you look at what are the initiatives, are there certain earmarked initiatives? They vary a little bit, but these are kind of the common 10 that you'll see, and I think we'll touch on a lot of these. I would say at the bottom there are two of the more important ones, and it sounds easy, but we know it can be challenging sometimes, but how do we break down barriers amongst institutions? Meaning academic to academic, academic to community oncology, with private, with government, and we know it's not easy. We know there's intellectual property. We know there's academic merit, et cetera, but there are touch points that we probably have not leveraged or accessed even. And so we'll definitely talk about this today. And we'll probably touch on all of these as well. Early detection, immunotherapy, omics analyses, and then you have all this great knowledge and data. How do you implement it into the community in a rapid fashion? So we hope to talk about that. And this has also been publicized. It's not been apportioned yet, but the Vice President is working very hard on our behalf to garner an extra $1 billion on top of the existing NCI budget for the Moonshot effort. And $1 billion, it's fantastic and we're thrilled. It's actually not a lot, and I think they realize that. I think one of the really key messages coming from the White House and the Vice President is they're going to do everything they can to help this effort, but at the same time, the federal government's not going to do everything. It's on us to help move the ball forward. So the hope is there'll be 195 million added this year, in FY17, 755 million. And that's part of this initiative. So that really led to today, that started in many places this morning, the Moonshot, and so summit. And so what is it? It can't be achieved by one person, one organization, one discipline, or even one collective approach. It's going to require millions of Americans speaking up and contributing what they're able to do. That's what the Cancer Moonshot Summit is all about. And we do have, he did do a video recording this morning that we're going to play. He went 8 minutes over, but we are going to we're not going to cut off the vice president. We're going to catch up time. And so what is the charge of all the summits? It's bring communities together. Fair to say this is New England community. And discuss is just step one, but it's really the second two that we want today. And as I've told a lot of the panel members, we don't want this didactic. We want it as really a working group think tank. And it's hard, again, we only have 4 hours together, but we have 3 topics that we'll talk about. And so we'll take our guidance from the panels, but we do want it open discussion. And so we're videotaping everything and keeping notes, so we'll be able to go back and really, hopefully, have our New England executive summary to submit back to central office. And we want to generate ideas how organizations can better engage in the national and concurrent local effort. So what is today? Think tank, and we want to, of course, talk about what's already going on, but I think in talking to the White House, it's fairly blue sky. In other words, they want new ideas. They want to figure out great, we've done it this way, what are some new ways to change it, to make it better, et cetera. And so that's what we hope today in our New England Summit. And again, we want very interactive dialogue, and our hope is, frankly, we'll come out of this with some potential new collaborations, whether it is academic to academic or other, including public and private. So how do we access is a very important part, and so you can, as you probably saw from our invitation, that this is not about Tufts, it's not about any academic center. We've really, actually, we're very intentional not to have it at our center. We wanted to have it somewhere away from our center, number one, and number two, to really have this revolve around community oncologists, and moreover, around the patient. In other words, as crazy as it sounds, have the patient in the middle and have us orbit around them, whether it's academic center, community oncologist, pharmaceutical company, patient advocacy, et cetera. And how do we, and obviously that's not easy, and it takes a lot of coordination. So what are our themes? I think everyone can see from the agenda, and there's everyone's titles and everything. We're going to try to keep things moving a little more quickly. And so, but the first one we'll have is our impact of patient advocacy towards success of the national and I would say local New England Summit. The second is disrupting the status quo to accelerate more cures for cancer. And so there'll be some more for-profit companies, but private companies talking about really precision medicine. And how does that apply, and how do we integrate it, especially into the community and community oncologists? And then lastly, we decided to title it Leveraging Unique Resources for Cancer Precision Medicine. So maybe be a little more academic and educational, but we have really 3 of the top leaders across the Tufts Health Sciences campuses to help us lead a discussion. So, I want to quickly acknowledge the co-host, just if you could come up, Tracy and Murat. So Dr. Weisberg runs I'll say, prolific practice in Maine that really more than 50% of all Maine runs through, 50% of all cancer cases run through Tracy's practice out of Scarborough, Brunswick, and now Kennebunk. But I think you can use the microphones there. I just want to welcome you.
Thank you. So my name's Tracy Weisberg. I'm the lead physician. I have 14 equal partners, but I'm the physician leader right now of New England Cancer Specialists. We've been in existence as a physician-owned private practice now for a little over 37 years. Practice started in our founding partner's home on the Western Prom in Portland, Maine, and has grown to now seeing 49,000 patient visits a year and providing cancer care through an oncology medical home for largely the southern part of the state. And I was fortunate and blessed to meet Dr. Evans almost a year ago and to be included in this type of Moonshot event. And I'm grateful to be here today and to be working with all of you.
All right, thank you. Murat?
Hi, my name is Murat Anamur, and I'm practicing oncology in Lowell. This is my 27 years, so I started at the age of 17, one of those kids. And in the last 10 years or so, I'm also the medical director of the cancer center. So I get a chance to see a small community practice evolving to more comprehensive community-based cancer center, including clinical research, multidisciplinary consults, palliative care. So the interesting part I'm seeing with the Moonshot and these projects, and I'm glad I'm here, is kind of this wall, of course, we always experience between community practices and academic centers, always been a barrier. I mean, our practice is maybe 20-minute drive from Boston, but it could be 2,000 miles. So this is not the right way to provide patient care. So I am hoping Moonshot, and we'll discuss it more, hopefully is going to create a little bit of a better platform. So how this cohesive, cancer care could be provided. So I'm very glad to be here. Thank you.
Thank you, Murat. So yeah, I would say the two kind of cross-cutting themes along those three major themes I talked about are, of course, the patient who's in the middle, but community oncology. We kind of want to make sure every discussion can be framed, does this make sense for the community? So, and we've really held it out, but at the very end, we're going to kind of lead by example. And so it's more of a preview. We're not ready to do a whole big balloon announcement, but we are starting. We've been working on it for 3 months, a new collaboration, scientific collaboration across multiple Boston academic centers that will include the community. It's going to be called the Boston Immunotherapy Initiative. It's starting with MGH, Beth Israel, Tufts, and a small piece of Dana-Farber will actually be initially with it. And we're going to welcome Mark Poznansky towards the end of the last session. But it's maybe a small thing, but we think it's the first time, frankly, all Boston centers have worked together. And it's investigator-initiated, old-school clinical trial science. So we're really, really excited about it. It's early. So we're going to have Mark towards the end of, as I mentioned, the last session. So we're really excited about that. And for any of the Twitter aficionados out there, so this is supposed to be the hashtag, if you want to tweet, is hashtag CanServe, and just use the tag @VPLive or @VP. That is the tagline. And so if you go on, there's quite a lot going on today on the hashtag CanServe. So again, we want to try and stay on time, so that's why I went through a little fast, but we want to quickly transition. So this isn't live. These were remarks live. Actually, Carol Burnett introduced him. So I apologize to Carol, but we're cutting off her remarks right into the Vice President's 38-minute speech. But thank you again, and we're going to work.
We all are. Ladies and gentlemen, without further ado, the Vice President of the United States.
Thank you very much, Carol. Please, thank you. Please. Please, thank you so much. Mr. President, let me thank you by offering Howard as a venue. This is an important meeting. Before I go through the introductions and the recognitions of people, Carol came into my office yesterday, and it was like we'd known each other forever. Although I've watched her, I felt like I know her. But like many of the survivors that are in this room or patient advocates, the stories of our children and our spouses and our brothers and our sisters who have not, who fought the good fight and ultimately succumbed. it's amazing the spirit of so many of them. She was telling me about Carrie, and I started talking about, and I will not do this, I promise, about Bo, my son. And I was thinking when she was speaking that he was at 3 different hospitals over a year and a half. By the way, if there are any angels in heaven, they're all nurses. You docs are okay, but they're all nurses.